Good morning, Dr. Abdul.
Good morning.
Good
Can you
morning.
hear us?
Good
Hi.
morning.
Thank you for joining us.
Yes, I heard.
Okay.
Thank you. Thank you very much.
Dr. Abdul, can you please explain to us what are spinal injuries?
Okay. Uh, Good morning, everyone. Spinal cord is damage in any part of the spinal cord or nerve in the spinal vertebrae. Yeah?
Okay.
So we know that spinal cord in the middle of the spine bone. Yeah? So if there was any injury to the bone and can make the injury to the spinal cord too. Now,
Okay.
is according of the area. Where is the area of the spinal cord itself? Yeah, and then
Okay.
we know that the spinal cord is the function is stimulate. Uh, continue stimulation, electrical stimulation from brain to our extremity. If there was
Okay.
it was injured in the spinal cord, so can be make any loss of function, loss of motoric function, sensation, autonomic function loss from this area to below of this area. So that why is very dangerous injury in the spine surgeon in the spine. Yeah,
Okay.
yeah.
What
I
are the
think that's the most common. The most common cause is caused by, like we know that from Ana Laura, motor vehicle accident is the most common the cause,
Okay.
and the fall from the more than 2 meter height maybe usually,
Yeah.
and sport injuries like football, soccer, it can be make the spinal cord injury like this, and
Okay.
many acts of the violence like gunshots is can make
Wow.
the injury in the spinal cord. I think that
Okay.
is the cause and definition of the spinal cord itself.
Okay, so there are many causes, and one of this, that the one that you mentioned before is when you
exercising?
exercise, right?
Sports, yeah. Especially
Yeah.
like full contact sports, right, Doc? But Doc, what are the signs and symptoms? Like loss of feeling, or can you explain more?
Yes, the common sign in the first time the patient maybe have chief complaint pain in the area of the injury. If the area injury in the cervical, the pain in the cervical. If the area in lower back pain and maybe pain in the back area is the first chief complaint patient comes. If the patient in the motor vehicle accident, if the patient in the car and he said any pain in the neck, please don't move this patient. Go
Okay.
call the specialist to remove this patient in the car. Yeah.
Okay.
So because if we in the first time we lost, so the patient maybe can lose cannot be healed very good.
Okay.
If the first time we have good condition, so the patient can we can cure and have a good prognosis. Yeah.
Okay.
And the other symptom is depend of this. If the injury in the cervical, the patient have tetraplegia. All of the extremity, like the upper and lower extremity, was lost. Motoric, sensoric, like didn't feel of touch sensation
Okay.
or head heat, yeah, heat or other sensation is lost, and bowel and bladder symptom was lost, is cannot
Oh.
control, and the other symptom is maybe
Okay.
tingling sensation around of the injury. Yeah.
Okay.
So if if if, if any
Okay.
this symptom, we must take care of the patient in the spinal cord injury. I
Okay.
think like this. Yeah.
Okay. And Dr. Abdul, we also want to
Yeah.
know when there's accident that are happening in front of our eyes. What does what do we need to do? Because there are so many people wanting to help, but we don't know for sure if it can injure the person further. So, what should we do if we don't want to injure the spinal cord of the victim?
Yes. Okay. Our principle, our first, the step is it can make better or worse. It's according of the our first step. Yeah. If firstly, if we found a patient with a spinal injury, the protection first is cervical, like this picture. Yeah, the protection of the cervical is
Oh, okay.
important using cervical neck collar or brace, and then very careful to move the patient to on board, like
Oh,
on
flat
board
board.
spine on board like this, like and then secure, not make injury more worse than first condition.
Mm.
And secondly, after the first step already finished, we go to the check the airway, breathing, circulation, according of the ATLS protocol. If clear, we can go to the check further investigation using X-ray or CT scan or MRI to know what happened in the spinal bone and spinal cord itself. I think that to know the principle is uh, better you think your patient in injuries until prevent otherwise.
I
I
see.
think like
Okay.
this.
I see. I think what should be highlighted it's that we have to make sure that we don't move the patient right
Yeah.
before the medical personnel came to the scene. Okay.
Doctor, like in the scene of accident, what's to check?
Yes.
Do we need to check the breathing? Do we need to check the airway? Are there any like first life support tips?
uh, tip to know that any injuries or not. Yeah.
Yeah.
Maybe the test we can check in the after we do the ATLS protocol, like I said
Okay.
before. We if the patient in the conscious condition, we can ask the patient
Okay.
what is the chief complaint the patient, and if patient unconscious is another problem. Yeah.
Okay.
And commonly in the emergency, we do like we said lock roll technique, yeah, to know the local condition of the spine in the cervical, in thoracal, or in the lumbar. We need 3% first to stabilize the head and the neck, and the
Okay.
second is to stabilize in the thoracal and lumbar, and the third is in the lower extremity. In the ones in one step, we go to the lateral position the patient and check 1% check from the spine to the sacral, any swelling or not, any hematome or not, any wounds around of the injury, any pain or tenderness in this area. Yeah? Any step off, we can palpate all of the spine in this area. If the patient said, "Oh, this area must be," we must concern that the area was any spinal cord, or we check further investigation using X-ray, radiological examination. Yeah, and the third step is a test to know it is the complete of the spinal cord or incomplete of spinal cord. Complete, it means no electrical stimulation go to the lower part. So no one
Okay.
like sensation or motoric. Yeah? But if incomplete, still any sensation or motoric below the level of injury, still any. Uh, to know that, we must check the neurological status, like motoric function. Maybe if the patient in the conscious condition, we can try the patient to abduction of the shoulder and make move in the finger to know the level, and the lower extremity we can check like that. And then the second, we check the sensories. We maybe touch the skin in the surround of the area,
Okay.
and we can compare to other parts still normal, like in
Okay.
face or in the neck, the other. And if the patient said, "I didn't feel anything," so it means anesthesia from this level to below this level. The third test is to know the severity of the spinal cord
Injury.
injury, about the autonomic function like bowel and bladder. Yeah. Uh, from from this test, we can conclude the patient in complete of the spinal cord or in complete spinal cord. So what the next step is according of this
Injury.
examination.
I
Yeah.
see.
Yeah, that after that we do like I said before, radiological examination, X-ray, CT scan, on MRI. Yeah, but sometime we got patient with a good neurological examination, good neurological status, but the bone is fractured. So we
Oh,
must
okay.
careful with this condition. It can be concluded after radiological examination.
Okay.
So don't believe that your neurological status is okay, no problem. The patient, no, still waiting for the radiological
Okay.
first. If the from radiological we clear, we didn't have any fracture or dislocation or ligament injury surround of the injury, so we conclude the patient is good or not. Yeah.
Okay. So
Okay,
so we need to go through all the thorough examination to really determine whether the injury are severe or not. But I also want to know what kind of complication can occur from a spinal cord injury, because as we know, in Laura Anna's case, that she's paralyzed for 2 years.
Okay. We divided in two complication, late complication and early complication. Early complication when patient came to us in the emergency, the two common complication in the first time is respiratory failure caused by injury in the cervical, and the second is hemodynamic unstable caused by what is sympathetic problem. Yeah, sympathetic problem. The yearly complication can we find it the first time when the patient came to the
Okay.
our emergency, and then the other is the complication is late complication like respiratory system more difficult. The patient asked maybe one more difficult to breathe and cope, or increasing risk of it can make increase the pneumonia infection in the lung, other lung problem. Yeah, in it. The second complication is usually circulating control. Circulating control make the low blood pressure. If the patient rests or standing, the low blood pressure will come because the usually caused by loss of the sympathetic problem. Sympathetic it make the balance and heart and circulation. So it is lost because of the spinal cord injury. Usually we can find swelling in the extremity of the patient. The circulatory chain can also increase the blood clot. Blood clot, it means the hematocrit in the blood is increased and make the deep vein thrombosis or pulmonary embolism. So it is the maybe cause what happened unallowed thrombosis or other
Okay.
factor, late complication came and make the patient like this. The third complication is bladder control, need catheter routine.
Oh,
It
I see.
very risky to increase the infection from the urinary. And the fourth is bowel control, need high fiber diet and high regulate bowel. Yeah, it is very complicated,
Yeah.
so that it can make infection too.
Right.
Pressure injuries because the patient didn't loss of the sensation, so the patient in the supine in a long time make the wound or pressure sore in the sacrum. It can make the changing position is frequently have this
Oh,
condition.
Correct.
okay, okay.
Doc, I have to
The
cut it
other
right
is
there because
yeah,
I've got one
yeah,
more question that I want to ask. Is spinal
yeah.
injury curable, and what are the treatments?
Yeah, curable. If we have a patient in the first time with good treatment, we have excellent what outcome in our patient. Yeah, but if the patient in the complete condition, yeah, like I said before, if complete is still challenging until now,
Yeah.
because complete condition still we research, yeah, with stem cell and other method to healing of the problem in the spinal cord itself.
Okay.
If in the incomplete or good excellent of the motor function, I think the patient still good. But if the incomplete condition still challenging until now. Yeah,
Okay.
until
Okay, thank you so much, Dr. Abdul Kadir Hadar, for sharing your knowledge about spinal cord injuries. Thank you for your time and stay healthy.
Thank,
Thank you, doctor.